Tell me a little bit about where Cleveland Clinic and where you think the field is in meeting the intent of the law of improving quality and care.
So I really think that when you're looking at meaningful use, there is a spirit and there is a letter of the law. The spirit, in my mind, is really focused on the provider's obligation as it relates to the patients we care for every day. So as I've said before, our goals should be higher than meaningful use, and it should be focused on using these new tools to explicitly drive quality, safety, and service, and to do it in a cost-effective way. When you do that, you're delivering value to our patients. Now, meaningful use I always describe as a start because I believe it creates a lot of the infrastructure that's going to be required to hit that higher level goal, but one shouldn't design their whole clinical information systems development process to the letter of meaningful use. I think if we do that, we will then miss the opportunity to hit the broader spirit of the program.
So we just sat through a session where you talked to some physician leaders and you heard a lot of concern about that the vendor products perhaps aren't getting to that clinical point. So what's that dynamic like and how does that have to change?
So I think what has to change is really engagement. And we have engagement programs in all of our healthcare facilities, engagement from our employees, being focused really on patient experience as we go forward. And I think that the program that we need most importantly now is what I would call workflow design, clinical workflow design. And more effectively, the physician community can learn to work with the vendor community, the more likely we are to come up with solutions that are targeted at the spirit of the law rather than the technical details.
Okay. And lastly, one of the things that came up in the HIMSS leadership survey was the concern about privacy and safety, privacy and security of medical records. Tell me how at the clinic, you guys, the Cleveland Clinic, you view that role of security, confidentiality, and privacy.
Yeah. So I really am focused, when we talk to our patients, they make a distinction between security and then what I would call privacy. They most often describe it as confidentiality. So on the security side, I really think that horse has left the barn, that our patients expect us to be doing everything we can to maintain the technical security of the information that we manage on their behalf, just like they do for retail organizations, banks, or airlines for that matter. Now, I think the real challenge for us is that they have a higher expectation around confidentiality. And it is complicated because they are clearly part of that puzzle. They can't make the firewall more dense at a given organization. But they can be part of understanding what confidentiality means for them, and that means that they have to be actively engaged. And as we think about providing confidentiality in the tools that we use, we must give patients the ability to actually see what's happening. Now, you can do that in many ways. We use a PHR where the patient can literally go in and see who's been doing what with the information in our organization. It's going to get a little more complex when we get to the health information exchange environment, and especially when we move away from patient-driven models to models that are really driven for clinical care purposes. And so there's a lot of work to be done in that space yet, I think, in order to gain the patient's trust.
You've had that PHR project going on for a few years now.
Yes.
Is there any aha that happened when it comes to confidentiality and privacy that you would relate to the rest of the field?
Yeah, so we have been doing this for 4 or 5 years. So the big aha for us happened 4 or 5 years ago, and it really was around this idea of who should be driving the exchange of the information. And we've done several national exchange projects with Google and with Microsoft, and what was clear was the aha moment was that when it was clear to the patient that they controlled the movement of the data, you could accomplish exchange in many forums. The second you removed the ability to do that, you constrained their sense of confidence dramatically.
And was that tethered to your internal EMR then?
It is.
Okay.
But it does function as a full health information exchange.
Well, thanks for your time.
Thank you.
Thanks.
Great.